The following advertisement is paid for by USA Clinics Group.
Hi everyone, I'm Gina Gannon. Thanks for joining us for Local Spotlight. Today we're putting the spotlight on women's health with a focus on fibroids. And joining me to discuss this really important and timely topic is CEO and founder of USA Clinics Group, Dr. Jan Katsnelson. Doctor, thank you so much for joining me today.
Thank you for inviting me.
First and foremost, we hear about fibroids so much. Can you tell me about fibroids and how common they are?
So fibroids are a benign tumor in the uterus, and they're not cancerous, but they're benign, but they still affect women's life. It causes prolonged heavy menstrual period. It causes miscarriages, pain, frequent urination. It, for some women, completely destroys their lives, and women just think that it's part of being a woman to suffer, and it shouldn't be.
So then tell me, what are some symptoms that someone can look for to maybe say, oh, you know what, I think I might have that?
So most common symptoms are related to menstrual period, the length and heaviness. Heavy, prolonged period, very common, leading to anemia, weakness. Sometimes period can be 1 or 2 weeks.
Wow.
Pain. Miscarriages can be first symptoms that patients know. Fibroid tumor competes with the baby for blood and space, and it leads to miscarriages.
Wow. So it's so important then to raise awareness and kind of talk about the symptoms. What are the treatment options available for fibroids?
So the good news that it's very easy to check whether you have a fibroids with the ultrasound. If you have the symptoms of prolonged heavy menstrual period, miscarriages, pain, frequent urination, just ask your doctor for ultrasound. Ultrasound takes 10-15 minutes, transvaginal, transabdominal, and it will be obviously yes or no. In rare cases, MRI is needed. After that, there are multiple treatments, but they're treatments that I think very bad, like hysterectomy, removal of everything, seems like very, very aggressive and unnecessary for benign disease, and minimal invasive treatments. Like, for example, uterine fibroid embolization is very universal treatment that doesn't matter how many fibroids, the location, the size, can be applied by decreasing the blood supply to uterus. 30-40-minute procedure in the office, an hour later women go home covered by insurance and managed Medicaid. It's like stopping watering the grass, and grass dies and disappears. The same thing with the uterus. We stop watering blood supply to the fibroids, and they just disappear. It was approved for 30 years, but women don't know. There was a recent study published, almost 1,300 patients, that showed safety and efficacy and a tremendous improvement in the quality of life in women after outpatient UFE. You don't have to suffer, you don't have to normalize this bad life. You can just have the best version of your life.
Now, I know that there is a really phenomenal event that will be very empowering for women and part of women's health. Can you talk about the event?
Fibroid Fighters was around for 8 years, and we have events in different cities. This year event on July 24th in Marriott Marquis will be phenomenal. Live performances, reception, a lot of glamour, real celebration of women's empowerment. I hope more than 1,000 people will show up and enjoy and learn and have a good time. I hope everyone can come. We'll welcome everyone.
Thank you so much. It sounds like a great event. Thank you for shedding light on this important topic that affects so many women. It's really great to talk with you. Thank you so much.
Thank you for inviting me.
And thank you for joining us today. For more information on everything we've discussed, including the event Dr. Jan shared with us, visit fibroidfighters.org. For Local Spotlight, I'm Gina Gannon. We'll see you next time.
The preceding advertisement was paid for by USA Clinics Group.